I'm Heather. After many wasted years trying outdated approaches to my daughter's addiction that felt wrong to me, harmed our relationship, and didn't help my daughter, I finally found an effective, evidence-based approach that repaired my relationship with her, helped me create my own peace of mind, and made me an ally in my daughter's recovery. I teach you a loving and compassionate approach to help you encourage change and create connection. Addiction impacts the entire family system. Family recovery is the answer. Today's topic is harm reduction. And I've wanted to talk about harm reduction for a while because it's my dog. It's like 8:45 at night and she gets really rambunctious when we work past 8 p.m. She is just this is past her working hours and she's letting me know. So I'm going to keep going. She's running around and being rambunctious with a toy. But I wanted to talk about harm reduction for a while because it's a helpful concept and because of my initial reaction to it. I reacted to it with judgment because I saw it as permissive. I was looking at it from a place of fear and control because that's where I was in my journey when I found out about harm reduction. My lens had not changed yet. I wasn't in that compassionate and understanding place. And it was not easy for me to make that change. There was always doubt there in different situations. And I want to remove as much of that judgment and doubt from the situation for you as you listen to this. What we're going through and what our kids are going through is hard enough without constant self-doubt. And we need tools that work. So hopefully this episode helps you with that. According to harmreduction.org, harm reduction incorporates a spectrum of strategies that includes safer use, managed use, abstinence, meeting people who use drugs where they're at, and addressing conditions of use along with the use itself. Because harm reduction demands that interventions and policies designed to serve people who use drugs reflect specific individual and community needs, there is no universal definition or formula for implementing harm reduction. However, National Harm Reduction Coalition considers the following 8 principles central to the harm reduction practice. Number 1, accepts for better or worse that illicit and illicit drug use is part of our world and chooses to work to minimize its harmful effects rather than simply ignore or condemn them. Number 2, understands drug use as a complex, multifaceted phenomenon that encompasses a continuum of behaviors from severe use to total abstinence, and acknowledges that some ways of using drugs are clearly safer than others. Number 3, establishes quality of individual and community life and well-being, not necessarily cessation of all drug use as a criteria for successful interventions and policies. Number 4, calls for the non-judgmental, non-coercive provision of services and resources to people who use drugs in the communities in which they live in order to assist them in reducing attendant harm. Number 5, ensures that people who use drugs and those with a history of drug use routinely have a real voice in the creation of programs and policies designed to serve them. Number 6, affirms people who use drugs themselves as the primary agents of reducing the harms of their drug use and seeks to empower people who use drugs to share information and support each other in strategies which meet their actual conditions of use. Number 7, recognizes that the realities of poverty, class, racism, social isolation, past trauma, sex-based discrimination, and other social inequalities affect both people's vulnerability to and capacity for effectively dealing with drug-related harm. Number 8, does not attempt to minimize or ignore the real and tragic harm and danger that can be associated with illicit drug use. If you noticed as I was reading the harm reduction that it is not black and white, right? It's not one size fits all. And that's what I like about it. It's realistic, respectful, and compassionate, and it's focused on safety. And so that brings me to telling you about today's guest. I met her during a training that I took last month. It was the Invitation to Change workshop. And Invitation to Change is similar to craft. And I was drawn to Laura's compassionate approach to helping families with their loved ones' addiction. So I reached out to ask her to be on the podcast to talk about harm reduction today. Lara Okoloko is a licensed clinical social worker in Washington State. She has a private practice working as a family therapist. She also teaches Master of Social Work students and supervises new clinical social workers in the field. Before working as a therapist, she worked as a medical social worker and a social worker with people experiencing homelessness. In her therapy practice, she focuses on working with families who want to help their partners or children of any age find healing from substance use problems. She uses an evidence-based counseling practice called community reinforcement and family training, an alternative to confrontational interventions or Al-Anon. She is also a certified craft trainer. She advocates for any approach that helps people stay safe, improve their quality of life, and recover, including harm reduction. She has a real passion for improving the field of services for people with addictions. Like other medical and behavioral health issues, she says that people with substance use disorder deserve access to high quality, dignified, and respectful services for themselves and their families. Her work is also shaped by her alliance with intersectional feminism and her commitment to an anti-oppressive practice. I hope you enjoy our conversation that you're about to hear. And more than that, I hope that it removes some of the doubt that comes up around safety and compassion. When you're done listening, make sure you check out the show notes for links to everything that we referenced in the episode and also Laura's website. Hi, everybody. We have a new guest on the episode today. Lara Okoloko agreed to come on and talk about harm reduction, which is something that's been on my podcast wish list for a while. Probably because my initial response to harm reduction when I heard about it was I didn't really understand it and it was a little bit negative. And so I think the better understanding that we have something like harm reduction, the easier it is for us to implement new processes like that with our kids. So it helped me a lot with understanding my daughter and not expecting perfection and not causing more painful feelings between us than we were already experiencing. So, Lara, thank you so much for spending this time talking with us today.
Yeah, I'm glad to be talking with you.
So, the first thing I want to talk about is how you explain harm reduction to a family member when you introduce that concept to them.
I was thinking about that in preparation for talking to you about it and realized I don't really do a formal introduction of harm reduction the way that I would to a student or to a new therapist that I'm supervising or on a podcast like this. That usually I'm saying something about harm reduction to help a client of mine understand maybe why I'm answering a question the way that I am. And my answer is usually very simple. So I might say something like, I believe in harm reduction, and that's why we're going to prioritize safety here over strategy. So I might say something very simple like that, or whatever is relevant to what we're talking about. That I might talk about why we're going to take a respectful approach and respect someone's boundaries or rights. So it's usually a pretty short explanation that really doesn't get at like some academic answer about the depths of the philosophy of harm reduction, which is probably what we might talk about a little bit more.
Yeah, my introduction to it was there's two things that I really remember. One was my daughter was on probation, and the person that she reported to, I don't want to call him a probation officer because she was a minor and it was just, she was just refusing to follow directions. So they started putting her on more and more restrictions, but she had to do twice a week drug tests. And he was the first one to really tell me about harm reduction. And his explanation was just that they wanted them to use less. They didn't expect full compliance or totally clean drug tests every time. But he said that to just me, not in front of my daughter, because they tell them the expectation is 100%. So that was like the first time it opened the door about it a little bit to me. So that opened my mind to it. And then the next time was hearing about a needle exchange, which I didn't have such an open mind about. Because to me, it felt like initially, like it was saying that it was okay, right? Instead of the safety aspect, like you were just talking about, like down the road when my daughter had more infections and she ended up in the hospital from injecting and reusing the same needle, I started thinking about it a little differently. Like, okay, well, maybe this is really important. And then, of course, after my daughter died, there was a thought, well, if she had been able to use safely somewhere with somebody around who had naloxone, she might still be alive. And so that safety aspect now have a totally different place in my heart with these realizations along the way. So if we can help somebody realize sooner today,
yes, I would say that actually that issue, my kind of description of harm reduction is usually just that piece, is just clients hearing me say, we're going to prioritize safety first. And that's usually kind of the only thing initially that people might kind of hear me say that they think maybe there's something behind that other than just prioritizing the person's safety. But I think you're talking about some of the common resistance to some of those ideas, that to provide for someone's safety means that we're approving or encouraging a certain behavior. And so I found it helpful in my own learning about harm reduction is to think about the parallels in other areas of public health or safety, because it's much more intuitive sometimes in some of those realms. So for example, wearing a helmet is a thing we do when we're doing risky activity. And would it be safer to never ride on a skateboard or motorcycle or bike? Yes. But if someone's going to choose to do that risky activity, then we want them to wear a helmet. And that doesn't mean that we think that it's good to be reckless. Seatbelts are another example of that. Condoms are another example of that. There's lots of examples of things that we promote people to engage in safer engagement of a potentially risky activity. And so I think sometimes broadening our concept of harm reduction helps it to make sense a little more.
Yeah, I really like that concept of thinking about it, relating it to other things that aren't, so we don't have such an emotional attachment to, and maybe there's not the stigma related to it. I think that helps. And also just, again, the thinking about the safety aspect of it makes it simpler for me. So is that really the hardest part about introducing harm reduction to family members? Is it the stigma and the beliefs about addiction, I guess? Or maybe like, I just hear this over and over again from parents, is just everything is the fear of, oh my gosh, am I enabling by doing this?
Yeah. And that's such a big question that people have about being really scared that they're enabling, which kind of underneath that, I think, is ways that people get blamed for the addiction that a loved one has. And it's kind of like a backdoor way of blaming people. And so even bigger than harm reduction is this like bigger idea of like, what does that mean? What does enabling mean? And how does one know that they're doing it? And is it a good or bad thing? Is it always bad? And the way that I address that issue with my clients is to really ask them to finish the question of enabling what? Because the important part of that question is the behavior that you're enabling. Is it a behavior you want more of or a behavior you want less of? So if you're giving your kid a ride to their outpatient sessions Are you enabling? Yes. You are enabling, making able for them to go to those meetings. Is that a behavior you like? Yes. Okay. Then you can keep doing that if you want to. You're not obliged to do it. You could say, no, I'm not going to give you a ride, but you're enabling a behavior you are wanting them to engage in. So, and on the other hand, if you're enabling, helping to make able a behavior you don't want them to do, you might consider not doing that one. You might consider picking other helpful behaviors rather than that one and helping your loved one in a different way.
Yeah, I agree. When you think of it more like, okay, what do I want to positively reinforce versus fear of what I'm enabling? Because every time you think of enabling, I feel like people convince themselves that anything could be enabling. So when you think about like, okay, what do I want them to do more of? Then it makes it a lot easier to decide. It's just so condemning.
Yes. And I think it can get in the way of families being loving and kind and present and in relationship when we have these kind of broad ideas of things to avoid and we don't get into some of that nuance of some of those terms. And as a family therapist for people with substance use problems, I don't want families to stop being helpful or kind or present or in relationship with one another, because family relationships are protective. It's an important protective factor for vulnerable people.
Yeah, absolutely. And I love the kindness aspect of it as well. Let's go back to can we talk about a couple other examples of harm reductions when it comes to abusing substances?
So I think there's kind of two realms of harm reduction. There's really where most of harm reduction lives, which is in services provided directly to people with substance use disorders, and which are not the services I'm providing because I'm working with the family members of people with substance use disorders. And harm reduction for families is a much lesser written about topic, covered topic. It's kind of on the sidelines of it. And so I don't want to ignore kind of the main parts of harm reduction, which is those services directly to people. But for the family side of it, to me, harm reduction for families looks like if your loved one has an opioid use disorder, then learning about overdose and how to recognize signs of overdose, having Narcan at your house if the person lives with you or spends time at your house. Providing stable housing is a harm reduction tool. Anything that makes people safer, even if they're not yet ready to be in treatment, even if they're not yet ready to change their substance use patterns, even if they're not yet ready to quit. So other things family members can do that are, to me, harm reduction is to be willing to continue to pay for health insurance or help your loved one get signed up with Medicaid or pay for co-pays or anything that removes barriers for your loved one to engage in healthy activity or treatment activity. Those are some of the examples of things that are harm reduction activities, because they're saying the message is, you may not be ready for what I wish you were ready for, but I'm wanting to connect with you. I want to be helpful to you. I want to be kind to you. I want to help you to take steps towards your own safety and well-being, even if it doesn't include abstinence from substances right now.
Yeah, I really like you said removing barriers. I think that that's a really great way to look at it, because a lot of times we hear the tough love kind of approach, like if they want it, they'll figure it out. And me going through my own health issues last year, I had breast cancer. I needed family support,
Yes.
And I can't even imagine anything else somebody saying to me, well, Heather, if you wanted it, you'd figure it out. Like I needed help navigating the health system just with that. And I had a clear mind. And so,
yes, and that's a much less predatory healthcare system than what people with mental illness and substance use disorders are trying to navigate. So I love that normalization that you're providing, which is you needed help, you needed support. And there's a lot of drawing those parallels are really helpful to understand the approach for harm reduction, that no one would say that you don't really want it or that or something negative about you if you wanted a loved one in one of those meetings to help you take notes because you're going to forget what was said. Or no one's going to think something negative about you if you want to get a second opinion. So there are things in healthcare that are totally okay for almost everybody. But when a person with a substance use disorder does it, we have a negative spin on it. We don't allow for the same type of help or support or encouragement in healthcare navigation. So that's another thing that families can do that I really encourage most of my families that work with me is to be willing to be a healthcare advocate for their loved one. That is a great role for families to increase the protective nature of their family relationship.
Yeah. And I was just thinking about how I could have easily been judged as saying like treatment resistant. I wanted to do things my way. I went to see multiple people. I didn't want to do exactly what my doctors were telling me to do. It was my quality of life that mattered to me. So if we can look at it from that perspective, like you said, like any other situation where we're navigating the healthcare system and how it's different for each person.
Yes. Well, and you just raised two issues that are relevant in harm reduction. And one of them is your right to self-determine as the patient. And self-determination is one, I think it's an important part of harm reduction, the philosophy of harm reduction, which is respecting the self-determination of the client. And as a social worker, that's part of my code of ethics. So that's important to me as well. And then you also talked about quality of life. And that's also an important harm reduction concept as well, which is we can support people in increasing quality of life, even if they're not ready for total abstinence.
Yeah, absolutely. I can see that. Like on the path with my daughter, before she was willing to become totally abstinent, she had to try. One point, she wanted to try just smoking pot, which was a huge harm reduction from injecting heroin. And I did not feel that that was what was best, but I had to allow her the dignity of figuring that out for herself. I can't imagine what it's like to face the thought of, I can never do this again. I'm never going to be able to use any substance without some resistance to it or some desire for trial and error. So I had to give her the dignity of figuring out that that didn't work for her and that she had to take it one step at a time on her own path.
Yes, you're doing such a good job of covering all the harm reduction topics, which is respecting the dignity of each person, of starting where the person's at. So, which is an important concept here, which is rather than saying, here's the bar you have to jump over, it's really high up here. And if you don't jump over it, then I know that you don't mean it, or you don't want it, or you're not willing. But instead to say, let me come meet you where you are, and then let's see where we can go from there. And so to me, it's really immoral, unethical, wrong to meet someone who says, I would like to, for like your example, I want to reduce or eliminate my opioid use, but I'm going to continue my cannabis use, and to say, I'm not willing to help you. Until you're willing to do all the things I want you to do, I'm going to provide you no assistance whatsoever with the life-threatening issue that you have because I have an objection to your cannabis use. I mean, I just can't understand that approach to helping people, rather than to say that is a great goal. And that goal really reduces a lot of harm and potential risk in your life. So I would love to help you with that and support you in that. And maybe that person will decide later that their cannabis use causes problems in their life and they'd like to look at that. Or maybe their cannabis use doesn't cause problems in their life. Or maybe it causes problems in their life and they don't want to look at it. They have a right to all those things.
Yeah, absolutely. And I can't imagine any other condition that somebody would be dealing with that they would be told, oh, there's only one way that will help you, or you have to do it this one way. I had a friend from the Safe Home podcast. She wrote a post one day about her son experienced that, where he was told, unless he totally quit everything, they wouldn't help him. And she was like, can you imagine if somebody was diabetic and we said, unless you quit eating sugar, we won't give you insulin or we won't do anything to help you. Like, it's unimaginable.
Yes, those are great parallels. Similarly, with just about anything, if we take depression, for example, that a lot of people experience, we know that medication can be very helpful to some people with depression. And also, if you don't want medication, I can't imagine being told you're not allowed to try talk therapy, if you're not willing to do the medication. So there's lots of other places where we have choice as the patient about what care we want to engage in, what our goals are. And so these are important parts of harm reduction, which is to start where the person's at, to do what works, to prioritize safety, to understand the client's goals and to work for the client's goals rather than your own, to, as you said earlier, about being able to take one step at a time, as you start where someone's at, to walk with them. Whatever steps they're willing to take, we'll do those ones. And often, change begets change, and momentum often causes more movement. And so that's great. That's often the path that people take to. Some people may start in kind of more traditional harm reduction approaches, end up deciding that abstinence is best for them or not. And that's fine too.
So can you give some examples of some harm reductions for the person with substance use disorder because I know as a parent, without specific examples, our brain's going to go to, is this right? Is this okay? So can you give some specific examples of that?
So for the person with the substance use disorder, harm reduction services are really anything that, one, has embodies the philosophy of a respectful, compassionate, pragmatic approach. And so that can include things like the examples you gave, like clean needle program or needle exchange program. Or it could include, if we think really broadly, it can include someone engaging in healthcare that doesn't include direct services for the substance use disorder. For example, having a wound or abscess looked at by a doctor, or psychiatric meds for other things that the person's experiencing. There also is a whole world of harm reduction psychotherapy, which is in the harm reduction umbrella, but is, what we would think of as like talk therapy with the harm reduction philosophy. And so there's a few authors who have written about harm reduction psychotherapy and have good books on that, if there are people listening who are therapists or counselors themselves that want to learn about it. But essentially, if you were looking for a harm reduction therapist for a loved one, you would be looking for someone who is knowledgeable about substance use disorders, has a warm curiosity about where the person's at and how they experience their relationship with substances, and wants to work with someone wherever they are on the change spectrum in a respectful way.
I didn't even know about that, because from what I have heard, in some ways, I know that therapists will not see somebody if they are using, right?
Yes, that's true. A lot of people, I think we've had a long history of abstinence-only services really being the standard of care. And I think that has begun to change. But I think it's made us feel that it's okay to tell people that we're not willing to work with them unless they're willing to work on our goals instead of their own goals. And I think that's been accepted for a long time. So I don't think that's okay, but I think that's been the standard for a long time.
Yeah, I agree, because you need tools in order to quit or reduce substance use. And how are you supposed to do that if nobody will work with you to give you the tools that you need?
Yeah, I mean, this substance use disorders is one of the few things that, to engage in therapeutic services, people often have to promise to not do the symptoms in order to get the help to reduce the symptoms. We don't really do that anywhere else. And so I think there's still, that really comes from kind of the moralistic beginnings of what passed for therapeutic services for substance use disorders, and still is like embedded in our treatment world in a lot of ways.
So how does the harm reduction approach help with stigma?
In the broad sense, I think it helps with stigma because we are doing the opposite of what stigma tells us to do, which is to judge, to stereotype, and to reject people. and instead says, we're going to be curious about people, we're going to be non-judgmental, we're going to respect people, which is not only about treating people respectfully, but about respecting their civil rights and their human rights, about not being coercive, about not trying to control people, to be respectful of people's boundaries. I think at its essence, it fights stigma to say, we're not going to treat people like second-class citizens. We're not going to treat people like unworthy beings. We're not going to treat people like they are unworthy now, and it is only through abstinence that they are going to be redeemed and become worthy people. They're worthy people now. They're deserving of respect and dignity now, regardless of what their relationship is with substances.
Yeah, I love that. And I've heard you say compassion and respect several times. And I think that that's so important because it's really often left out of the equation, and it wouldn't be acceptable under any other circumstances to not have a compassionate and respectful approach. But for some reason, that's what's happened over time. And I think that this conversation can go a long way to help make it more comfortable. That's the hard part for me when I look back and I think how uncomfortable it was for me for so long. And even after years of doing the work that I've done, the things that I was still in the end when my daughter relapsed for the last time, I was still struggling with fears of enabling and what's the right thing to do and the fear of doing too much. Right. And I mean, with hindsight, I wish I had done more, but there's still it's to me the hardest thing that family members or any other loved ones have to fight is that fear of that it's wrong to be respectful and compassionate, that you're harming them, the person that you love, more than helping them if you show up that way.
Right. Well, and I think what you're saying is really important because I do think this approach does require, whether you're the parent or family member or loved one, or whether you're the therapist, it does require managing your discomfort. And so I can understand why although I don't think it's right, I can understand the draw to work with a philosophy that says, when your behavior makes me uncomfortable, I'm going to tell you I'm not going to see you anymore until you stop that behavior. I think it is harder to be with people in relationship with them when they are suffering and when they're really challenged. And to be there, compassion by definition is painful. It is to share in people's pain and to feel for people. And I think we use judgment and rejection and termination from services. We use all those things in a lot of ways to manage our discomfort. And there's one of the kind of founders, leaders, important people in the harm reduction world are two people in San Francisco, Pat Denning and Jeannie Little. And I can't remember who it was. One of them was on a podcast I listened to years ago, and the interviewer had asked them a question about, well, something along the lines of, how do you manage when the people that you're trying to help are doing scary, dangerous things? And her answer was something like, it's exactly that. I have to manage myself first. I have to manage my own feelings and reactions first. And so when I think about my work with family members and how does this apply to the parents of someone with a substance use disorder, a lot of my work with the family member is about learning the difference between having boundaries, which is about me, versus controlling somebody else's behavior. Because if people can learn to know that difference and to understand what your own boundaries are, then you can still care for yourself, which is about boundaries to me is about knowing where your limits are. And you can know it's okay to have limits as a family member, to say this is too much for me, or I can do this for you, but I can't do this for me. It's too distressing to me. And that's not the same thing as saying you have to. If you don't, I'm going to punish you in some way, or to try to control the other person, but to say, I can respect your decisions to do certain things, do or don't do certain things you're deciding, but I get to decide for myself. what I can tolerate and where my limits are in this relationship.
Absolutely. And I love what you said about discomfort. I think that that's like the number one skill that I had to develop as a parent was just the tolerating my discomfort without reacting to it, with being able to take my time and have a measured response instead of a reaction that I regretted, and really not expecting her to fix my discomfort. And I mean, and that's something that's similar. I like to see our similarities that we have with our loved one is they have struggled with their discomfort, and the substance abuse is what relieves that for them. And, we're just doing different things to try to relieve our discomfort. And it's both of, unless we're able to tolerate our discomfort, what we're doing is not helping. And so,
that's the human condition for all of us. We don't want to be in pain. We don't want to be uncomfortable. And we develop all kinds of methods of coping with that, avoiding it, soothing it. Like we all do that. There's a lot of things about addiction that we can all relate to.
Yeah, absolutely. But when we can see that, instead of focusing on how bad and wrong, different it is, that we can see those similarities, it helps bring down some of the emotions so that we can think and reason through it. So, what do you think the hardest part is for parents or loved ones when it comes to opening up to the idea of harm reduction?
I think there are some pragmatic difficulties. I think it can be hard to find support when you're trying to use a practice or philosophy or approach that doesn't feel like the mainstream thing. And so I think that's a difficulty for people. So some places where people can find support are in looking for example, a smart recovery family and friends meeting or craft-based support groups for families from the website Helping Families Help. I think those are some alternative places that people can go to try to find community, which are not explicitly harm reduction spaces, but they are kind of respectful, pragmatic, compassionate approaches that don't have that are not built around detachment or hard lines. And so finding support so that you don't feel like you're doing something that feels like it doesn't have, that there aren't plenty of people out there that are using these approaches. And so I think community is important. And I think it can also maybe be helpful to just read about some of these approaches and how they are effective. And so even if you are don't live in the academic world and you're not a researcher and you don't have all these paid journal subscriptions to read those articles, you can go on Google Scholar and you can access millions of journal articles and at least read the abstracts. And so I think that's a way that people can also kind of fact check for themselves to say, these might seem like radical ideas because they're different than the mainstream, but they're really not that radical, especially if you're in the kind of healthcare research world where it's pretty accepted that these are helpful practices and effective practices. So I think those things are helpful. Getting support for yourself so that you can work through some of the things that we've talked about. What are the questions that come up for you as you're trying to help in this different way? And especially this piece about boundaries or limits for yourself, because I really believe that good boundaries, which again is not about telling other people what they have to do, but about knowing ourselves and our own limits, that good boundaries help us to avoid burnout. And when we burn out of relationships, we cut people off to feel better. Good boundaries help us to act in our own integrity in the relationships we're in. And good boundaries help us to avoid being resentful. And resentment's awful for relationships. So that feels like a really important part if you're going to stay present in relationship in one way or another with someone who might be suffering, might have a lot of chaos in their life, might have a lot of their own pain. It's hard to be around other people's pain.
Yeah. And there's even stigma and misunderstanding about boundaries. They're so often misused. And like you said, they're used to control or punish.
Yes.
And so then people are trying to do it and they've got these thoughts about that it's mean or wrong or when it's so hard for me, boundaries are love. And they really helped create a more loving relationship with my daughter. It was like the beginning of healing for us. But there's just so misunderstood. It's hard sometimes to come up with good boundaries. But I really like the way you explained it.
And what I would say to the idea of coming up with good boundaries is to even set that idea aside, and instead to think, how do I look inward to discover the boundaries? Mm-hmm. I don't have to think them up, which I think is often how people, especially because of what you're saying about people kind of misunderstand or misuse boundaries, is if somebody else is telling you where your boundary should be, it's not your boundary. But that's a process of feeling out kind of within yourself, either, and people can't see this video, but if they did, they would see my hands like hovering around my chest of like this feeling out process of how do I know when I've reached a limit? What does that feel like in my body? What thoughts or emotions come up for me? How do I know? So I first have to figure that out so that when I'm approaching a limit for myself, a boundary, that I can say, okay, I recognize this. This feeling I'm having is a sign for me that I have a limit here and I'm feeling pushed past my limit. So that's a discovery process.
Yeah, I love that it's a discovery process. And really just the things that we feel resentful about is a good place to start. Like, what are we doing that we don't want to do, but we're afraid to say no?
Yes. Resentment is a great place. If you feel resentment, you are past your limit. You have cruised past a boundary and you're out there. And this is what resentment does, is it distracts us from finding our own limits because we're focused on what's wrong with the other person. And so we're focused outward, and we really need to move our view kind of inward to say, okay, clearly I've passed a limit here. So let me back up and let me find where that limit is. Is this thing that I'm doing actually something I'm willing to do? If it wasn't, then where did I need to say no instead of saying yes? And that's for me, not about the other person.
Yeah, the problem isn't that they asked you to do that. The problem is that you didn't want to and you said yes.
Yeah, and it's certainly annoying when people ask us over and over again, and we've said no lots of times. That's annoying. But ultimately, it's our responsibility to decide when I say yes, I say yes willingly. And when I say no because I have a limit. I'm not willing to do it. And that ultimately, I have to be responsible for those things for myself, which is hard, but is empowering, because the power is with me to decide where are my yeses and where are my nos. There's a great therapist in Oregon, Cordelia Krause, and she talks about, let me get all the W's right, want, willing, won't. And I think that's a nice kind of frame for thinking about boundaries, about my willingness. I want to do something, I'm willing to do something, I won't do something. And so all these things are kind of this reorientation around boundaries to look inward and to feel something out for yourself rather than someone telling you where they should be or looking at what the other person needs to do. They need to stop asking me instead of I need to feel stronger about when I say no and when I say yes. So that's a lot of that is a lot of the sessions that I have with families are on issues around boundaries.
Yeah, it's so important. So is there anything that we haven't covered about harm reduction that's important for families to know?
I would say, I don't know if this is really like central to the tenet of harm reduction, but an idea that I think is really helpful is ideas of radical acceptance. And I think this helps families answer some of these questions around, they may not approve of things, but what does it mean just to accept that what is today is just what's today? And actually also, Pat Denning and Jeannie Little have an article, I think it was maybe 10 years ago, about harm reduction for families. And there's very few of these articles. So I will send it to you so that you have it as well. And one of the things that they write about is not hoping, which is not the same as being hopeless. And so, which is really in line with this idea of radical acceptance, which is we're really prone as people to kind of be on these roller coasters of like hope and despair. And so to me, not hoping is about kind of just getting off the roller coaster. That if I have a good day today with my loved one, or I see them and I look at them and I think, oh, they look good. Then that's great. They look good right now. And I felt connected to them right now. And I had a good day with them right now. Will tomorrow be good? Who knows? Maybe tomorrow will be good. Maybe tomorrow won't be good. I don't know. But if I can get off that idea of something good happens and I ride up the hope roller coaster, and then something bad happens and I feel despair and I plunge to the other side of like, it's never going to be good. They're never going to get well. This is always going to be bad. And so to try to get off that roller coaster and really kind of get your feet back on the ground, and what's in front of me is what's in front of me. Today is what it is. I can just accept things as they are. My acceptance is not approval. My acceptance doesn't mean that I'm saying this is what I want. It's just saying it is what it is. And I think that's another idea or practice that can be grounding for people, because that roller coaster is exhausting.
Yeah. For me, it was just like being in the moment with my daughter. I wasn't being in the moment with her if I was judging every single thing she did. Does it look like this is leading towards sobriety, or does it look like this is leading towards more use? Like, I'm not in the moment with her, enjoying her presence, if I am trying to figure out every single thing about every day, like you were saying. And then that's what would get me on that roller coaster, was just trying to figure out every little move and what does this mean and but instead I could just be present with her and love her in that moment and be really full of gratitude that it was a good day, and not try to figure out what it meant. Like all of those other things you were talking about really take us out of just being able to enjoy the moment and the person that we're with as they are.
Yes.
And that's real acceptance.
Yes. And if there are people listening that are not listening as therapists or counselors, but listening as family members, that I really encourage them not to have so much judgment about themselves in this process, to have compassion for themselves. Because a lot of what is written about harm reduction is written for therapists, counselors, doctors, helpers. And those are not the people who they're working with are not their beloved partner or child. And there is an amount of distance that we get to have as therapists, as practitioners, and that I do love the people that I work with. I care for them and I love them. They're not my family members. I don't live with them. They're not my children. So there's an objectivity, which we can't really have, but we can move towards it, hopefully, that we have with clients that we don't have with our family members. And so these ideas are hard to practice. It's really hard to not want to control when things feel out of control in our own homes. It's really hard to stay off that roller coaster when we're not just going to like write our note and put it down for the day and then go home. So I just really encourage people to have compassion for themselves in this very hard process of staying present and staying in loving relationship with compassion, because compassion is sometimes about sharing that pain, and that is so hard for families. And so that's my encouragement, is to be compassionate with yourself.
Yeah, thank you for that. That's so important. This is hard, and there's no easy answers. There's no one size fits all answers. We're trying to figure it out every step of the way as we go. And we really do have to move through that with a lot of compassion for ourselves, that what worked yesterday might not work tomorrow. And we're always thinking on our feet. It is not easy. We really have to give ourselves a lot of compassion for the situation that we're in. So thank you so much for your time. I really, really appreciate everything that you shared. I think that it will be really, really helpful for any parent that is struggling and it's hard to go against the grain and go against all of the things that people are telling you and all of the bad advice that we get as parents, and even some of the advice that we get from the professionals that doesn't feel right. And we have to go against something like that. So I really appreciate your respectful, compassionate approach to helping parents or family members and their loved ones that are struggling with addiction.
Yeah, thank you for having me on to talk about it. And I love what you're doing with your journey and having this topic on your podcast.
Thanks. Thank you for listening to this episode. If you want to learn more about my work, go to heatherrosscoaching.com. If you want to help other parents who are struggling with a child's addiction, you can do it 2 different ways. First, you can share the podcast with them directly, or you can share it on your social media. Second, you can leave a review. Talk to you next week.